Once again, Dana Point. It's been a while since you and I have been together.
Yeah, it's good to see you. Great to be here in this weather.
Good location. And by the way, if you hear some clanking, banging, etc., we're here the day before the LSI 2022 conference. They're doing some construction over there. So it wasn't our sound guys with bad audio. So a heads up on that. So it's been a fantastic 2021 for you. Lots of really exciting things going on. Can you bring a little bit of State of the Union, where Proximy's been first, and then we'll go into where Nadine's been too.
Sure. Well, yeah, I think when we last met, we were still about 30, 40 people. We were here at Dana Point. We were talking about the future of where Proximy was going and how we were going to continue to extend beyond OR telepresence into really becoming the data engine of the operating room, the digital nucleus that brings everything together. And it's been just an exciting, year since then. We've grown. We're about 140 people now. Mm-hmm. We've accelerated pretty rapidly in terms of the doctors we're working with, the healthcare systems, the medical device companies, industry partners. And more we're becoming really a gold standard platform in terms of how we really think more holistically and comprehensively about a digital continuum in the operating room. And as a surgeon who's practiced for over 10,000 hours in an OR, it's clear to me and all my peers that digitizing the operating room or really taking that connected surgical care to the next level is so much more than just about an application that solves one problem. This whole group of point solutions are great in that they are driving the thesis behind the digital operating room, but they're still disconnected. And that's really not shifting the needle as much as we need it to in surgery. And so where Proximy is really coming in is it's acting at that central point that's really connecting people, technologies, systems, and devices together to hopefully really shift and drive that future of surgery, which we all yearn for and really want to see happening sooner rather than later.
And the interesting thing about Proximy that I think is an advantage and a challenge as a leader is the platform is so agile. When most platforms come into medtech, sure, in the beginning they might pivot a little bit because they couldn't get financing or their IP couldn't get locked down. But Proximy has entered into this digital platform as such a malleable platform. And where other competitors in the telehealth have really, their rails were set from the day they created their platform, either because it was hardware centric or it was locked in the OR. And so what kind of challenge has that been for you as you've had to have been, and not in a response, but you're actually creating the market, Nadine, before the market existed. So how has that been on a challenge to you?
It's almost been the story of Proximy. I mean, even when I started, many years ago, it was always thinking about how do we build something that creates immediate value today? Because ultimately, when you're walking into operating rooms, busy systems, doctors are really busy, they're trying to get through their day, and you're talking to them about a future state, it's very hard for them to sort of picture that in a tangible way today. And so what you're trying to do is trying to create something that's valuable now, but is also future-proof for the future and also designing for the future. So you're giving value now and designing for the future in conjunction, which of course can have its challenges in terms of how do you stay focused, how do you scale what you have. This is the mantra of every early stage or growth stage company, focus, focus, focus. And so it's been a really interesting sort of design process and that user-centered design approach that we've taken in building something that is truly valuable today. And it's why Proximy is being deployed with so many partners and so many doctors around the world, but has already designed and thought of what the future needs to look like and is taking people on that journey with them versus trying to give them something that is too futuristic, that is hard to grab now and hard to materialize. And that's been an exciting, I think it's having the foresight and the vision, and it's a credit to the whole team really at Proximy, is thinking about the impossible and making it possible, whilst also trying to create a beautiful experience for people today that can hopefully unlock some pain points and friction that we face every single day in the operating room.
And you mentioned the staff augmentation that's gone on over the last 12 months. And like a number of people have knocked on your door. And we're talking about executives from billion-dollar companies almost. So you recently added a GM of the Americas, right?
We've been really lucky about our most recent hire, actually. Charlie Wilhelm was the president and CEO of DragonFly Stories, a great company, hugely successful. And it's just been an absolute pleasure bringing him on board. Someone with his reputation, with his credibility with the work he's done, his experience, his playbooks, all of that. Really having learned from the ground up. Charlie is really a person that's learned from the ground up, and those are the kinds of people that we want at Proximy, who've really had to roll up their sleeves and do the hard work, but have also been able to grow and scale businesses as he did Carl Storz Americas, over his tenure, over 19, 20 years. And so being able to bring that kind of scale and quality into Proximy, as we have a number of people, has really taken us to the next level of the potential of Proximy. And it's just been a pleasure. He's been with us for about 2 months now, and it's just been a huge pleasure working with him.
How hard is it to scale a commercial effort? Right, so Proximy came out of the gate, came out of the UK with you at the helm, and I remember the early days, and it was technology, technology, technology. Look how cool this is. And the tech swept through the industry very quickly, impressed a lot of people, so did you. Now, we've got to get boots on the ground in the US, and we've got to be a commercial sales organization, because eventually you've got to connect the tech to the revenue. And then, as mentioned, you've been so agile, and where is that revenue? And there are multiple channels of revenue potentially for Proximy, correct?
It's a great question. I think those are the points where, there's elements where we absolutely don't want to just become, a one-to-one type business. I need, one sales guy for every dollar, we end up, and that's how your business model grows. 300 salespeople, 300 million, that is interesting, and there's many, businesses that exist that way, but as a software solution, we want to continue to evolve our technology to enable as much, self-service, self-deployment, empowering individuals to just take it and run with it, make it as seamless and as straightforward as possible. And we're not fully there yet, we still have work to do. But naturally that kind of inflection of that scalability at a commercial level, at an implementation level, an operational level, is definitely something that we've really tried to bring in expertise to continue to help us take forward. So someone like Charlie, who's done this, at a huge level with the business he grew, is the kind of individual that we've brought in to help us really scale that in the US and in Americas. And that's kind of how we're looking at our business across the different regions. So, we continue to do work on evolving the system engineering of how we deliver things. And, it's through that and through great product people that we have in our company that we think about it. We don't think about just, I've got to build a software. If it works, that's great. We have to think about the whole thing. How do I deploy it? How do I implement it? How do I onboard people? How do I train people? And as much as we can do that in a light touch way, I think the more scalable it can be. Because that historical model of just putting lots of people in the field, I'm not sure serves the purpose of Proximy, but we definitely need to make sure that that doesn't compromise the experience people get either. So we're definitely working through that and trying to scale that and bringing in expertise like Charlie and others to help us figure a few of those things out.
So money makes the world go round, right? We all need money.
Yeah.
Financing, funding, SPACs. We're going to be hear about crowdfunding here over the next few days. But you're not a 510K, you're not a PMA, right? And VCs and investors in medtech understand how to invest against that pathway. And now Proximy comes along, and Proximy to me represents more like an Uber or some of these other digital platforms that existed as a solution that was badly required in the workplace, but nobody ever imagined it when Uber showed up or when Proximy showed up. And you're a first-time CEO. You've been a leader your whole life, but you're a leader now of an organization. So what were the lessons over the last year of working in that sort of gray area? You know where you're going with the company, but you're still a digital tech company. And the early investors are going to look at it and say, we have to invest it for being $1 billion exit, not where's our $300 million exit? So over the last year, you're a conspicuous outsider. What have you learned?
It's a great question. I think, often when you're in the investment industry talking to people about it, there's lots of different types, but they tend to fall down into sort of like the number crunchers, the investors that are looking at the bottom line, the revenue, and they're investing against that. There's the vision investors that are really just thinking about big picture, opportunity, future forward. And then sometimes there's those that are in between. And I think, it's been really interesting for me as we've met and learned from so many investors in the industry, the different styles and different perspectives. And, I think we fall somewhere down the middle because we definitely have an opportunity, a vision that is the TAM is huge. I mean, the opportunity is significant, but you have to build the foundations to get there. You know, I always describe Proximy like, you know, building the piping in a building. You know, you got to build the foundations, you got to put the pipes. And once you put the pipes, you can really then elevate and do all the great and exciting things that come after it. And so it's really understanding that, you know, you can't put the cart before the horse. There has to be an investment for the foundational elements, and then there's the investment of the future. Where does that take us? What does this pipeline unearth for us? Things that we may not even know yet, the value that we can still create. And so it's been really interesting meeting the different investor types and trying to find the right ones that mix with us and we can work with through that. We've been very lucky. You know, in our last round, we were highly oversubscribed, and we were able to select the right investors that really think that way and have that future vision of where this should be. And I think the other bit is having the investor that doesn't want you to exit at 200 million, that just wants it to be a quick turn and let's go, because that's a different type of appetite for risk, a different appetite for scale, a different appetite for growth, for margins, and all of the above. So we've been really lucky that the investors that have come on board have been hugely, you know, have huge conviction around where this is going. You know, one of our investors told us that, you know, this was, when Proximy was brought to their IC, it was the only company in a very long time that had a unanimous vote. Everyone wanted to back it across all their regions, which is, you know, very flattering, but, you know, hopefully means that this is such a needed technology that people see the benefit for. So, you know, I'm learning the different investor types. That's been a big learning thing for me, and, you know, managing and growing a team so quickly. You know, you know, I'm not going to say it's easy. When you go from 30 people to 150 people overnight, you know, it wobbles a little bit. You know, you have to be honest about it. I think people who say it's all smooth sailing, you know, I'd love to know what their playbook is. But with that, you know, I said it before and I'll say it again, you just have to surround yourself by talented, smart people that believe in the mission, because there's going to be ups and downs. And when those downs come, if you're all on the same page and trying to solve for the same mission, then you can get through that. And there's been people with me that have been with me since day one, you know, who you know, and you know, having them on the journey with me has been really powerful. But all the new people who have joined us and are taking that forward is also very exciting.
You're a very decisive leader. You're a phenomenal communicator, and I know that because you and I've worked together now for a couple of years. And I've been with some of the people who were there early days of Proximy, and either they decided or Proximy decided it was time for them to move along. And they all leave knowing that this has got great legs to it and will change the face of healthcare. How difficult is it as a leader to sit with somebody who's been there for a while now, and either the organization has passed them by skills-wise or requirements, or they're like, you know what, this is not what I signed up for 2 years ago, it's changed. How do you process that, and how do you have those tough conversations?
It's really difficult, and you know, one of the things I love about my role is recruiting people, bringing people in, and spending time and learning what motivates people, what drives them, what are their aspirations. And I spend, you know, quite a bit of time, especially in the early days of people joining, trying to really understand that. You know, up until very recently, I was still interviewing doing the final interview for every single person who came into Proximy, because I just want to know what motivates people and what do they want to gain out of being at Proximy. This is a reciprocal relationship. You know, I think I think it's quite arrogant to think that you're just bringing people in to work for you or for Proximy. You know, for me, it's really about what do you want to gain out of your time here. And I always say it to my team pretty openly is, you know, I wish people well at the point that they decide Proximy is no longer for them, or we make that decision. I just want to know that at the point that they move on, that what they gained from their time at Proximy has helped them, has developed them, has moved them forward, or has just been a great ride for them at the very least. And so that's something that's really important to me. And you know, as people move on or depart from Proximy, it's something I try as best as I can to make sure it happens. And it is sometimes difficult when you have to have those conversations, because you know, there's, you know, different people may be fit for different stages of a company. Some people really love that early scrappy 10 in a room, 10 to 15 stage, and the minute it gets to sort of 50 to 70, they're like, oh, this is just getting too big. I like the really early ideation stage. Then you have others that really find that the unknown and the ambiguity is too stressful, but would rather have much more structure and probably come from a corporate. And so it's really trying to find what drives people. And you know, I've been really looking at how do we evolve our recruitment process, the interviews that we do and how we spend time with people before they join to try and flesh some of that out as well. And we just hired a head of people who came from Amazon and from Revolut and from other industries to really start to shape that process a bit better. But it's, I still think of everyone at Proximy as my family. Even everyone who's moved on, still try to reach out to them, check on how they're doing, follow them on LinkedIn, make sure they're doing well, make sure they're invited to our Christmas, get together. So it's kind of like the third or fourth cousin that you don't get to talk to that often, but you just want to make sure that they're well. So yeah.
You mentioned Amazon right now, and by the way, we're working with Jim. Really enjoy him a lot.
Yes.
Right? I'm so happy for you that
Yes.
you got him on board.
He's great.
But you've got executives from Amazon who've knocked on your door and part of the team now. Meta, without going into names, also Instagram leadership, and then big J&J players. We had an executive out of Medtronic recently join. No name dropping, but like big brass out of these organizations, both medtech, non-medtech, and leading edge, like the Metas and the Instagrams. What's speaking to them from your side as you interview them and they come to you for that last session, because you're an important voice there, because they're coming there for you and the company. What do you think speaking to them?
It's a great question. I think when and I know we can sometimes belabor the mission point, and sometimes it loses its kind of, it can become lackluster after a while, but truly I think people, even more so since COVID, have recognized that the few things that matter in life are sort of health, family, those things that really matter. So you're finding people coming from, let's say, other industries outside of healthcare even, because they really feel that they want to have purpose and they want to give to something that is meaningful. We've got some incredible engineers that have joined us recently from major tech companies that are coming because they want to make sure that what they're doing is for purpose and for good. And because we're so close to the stories, we're not like 3 steps removed. When Proximy is being used to save a life, it's happening, and the team knows about it, and we're talking about it on our company stand-ups, and we're sharing those stories on our Slack channels that Proximy is used for these purposes. We have a global health arm. We're helping with safe obstetric surgery in Kenya. Like, this is stuff that's meaningful and is immediate. And so that stuff I think is really touching people. Needless to say, I think being a company that's clinically led and thinking truly about the end user is really important. And finally, I think even the ones that are coming from the big strategics, it's not like they haven't been trying to innovate in this space either. They've all been trying to innovate in the digital health space, in the digital surgery space. And they're making good progress, but it's hard. There's a lot of friction, there's inertia, it's slow. You can't make quick decisions and be empowered to take that forward. And naturally, they've been looking, at least that's what they tell us, they have looked at the market, at all the companies that are out there. They have looked at the digital solutions that are out there, and they've been very impressed by what they've seen at Proximy. And so it's a natural, like, I want to be part of that. This looks really great from the outside. I really want to get in there and see how I can play a part. And that's really fantastic for us because they come with very little learning curve. They've been looking at the space for so long. They know it. We talked about the executive from Medtronic. He's been looking at the space for 8 years. So by the time he joins Proximy, he knows exactly like where the gaps are and how Proximy can continue to fit those gaps. And at the end of the day, I like to be, at least as a leader, as much as I can be with the 150 team members that we have and all the schedules, is to be available, approachable, running sessions drop-in sessions where people can come talk to me about their thoughts, what they're thinking about. And I hope I can continue to do that and develop that further. So I hope that people feel they can talk to me, they can approach me, they can approach the company, and that we're really here to try and make a difference in the world.
So last question. If somebody watched Yours and Mine session last year from this show, what would they get, what do people get wrong about the Proximy platform? Because they're reading the press from a year or 2 ago. What are they getting wrong, and what should they take a second look at right now with Proximy?
Yeah, we tend to get pigeonholed into, we're just a telehealth or OR telepresence solution, which I understand because that was the first application that we put out. Remember when I talked about, we wanted to create something immediate so that doctors and clinical teams could touch something. They could see value in having systems in the OR that are generating audio and video outputs from that room. And so we initially got pigeonholed in that kind of OR telepresence. But the one thing I'd really want people to recognize is that we are so much more, and being a software infrastructure that can really extend beyond just the telepresence solution, really be that solution that can integrate into hardware devices, that can plug into different apps that are out there, different applications or solutions that are trying to find their way into the OR, that we can become that sort of data engine in a vendor neutral way that is really focused on the hospitals and the end user, supporting them to better understand what's going on in the operating room. How can we help them drive effectiveness, quality, efficiency, scale across their systems is really where Proximie has always been trying to play, but we've been more vocal perhaps about our OR telepresence, and we're trying to evolve the messaging around that. And that we're really here to stay for the long run. I mean, this is really a platform that is investing heavily in R&D to continue to evolve the tools and applications that are going to be meaningful. And I can't stress it enough. Time and time again, we see things that are built that are kind of a solution looking for a problem or aren't really solving the workflow. It's not just about a particular, does it fit in the workflow of a hospital? Because trying to go and change all the workflow of a hospital is really difficult. So trying to find the ways that you can break through and disrupt in a meaningful way rapidly is where we're working. So we spend a lot of time with clinical teams, with our doctor KOLs and others. So that's where I hope people will continue to see us evolve, and with all the partnerships and strategic players we're working with, the announcements that you've seen over the last year, even the most recent one with Vodafone, we'll continue to demonstrate that. This is so much more than just a telepresence, otherwise those partners wouldn't be plugging in.
For sure, the number of partners you have is always, I mean, if you haven't seen, go online and look at all the partnerships that you have. Is every strategic, every mid-cap, again, big telecoms outside the industry. So that should be some indication of some really smart people see where the future's going with Proximie. Yeah. Well, Nadine, as always, I love these sets, and thanks for bringing everybody up to speed on where Proximie is.
Thanks for the time. Looking
Always.
forward to our next one.
You got it. Joe Mullings from LSI 2022, Dana Point. Be well.